Hi guys, so today my mother and I, she will actually be behind the cameras, but we're going to be talking about my experience with my left hip replacement that I recently had earlier last month, actually May 9th to be exact. So she's going to ask some questions, I will answer them. So it'll be information that you guys possibly would want to know if you're having to go through the same process. If you would like to see what I have in store for you guys regarding my left hip replacement, please keep watching. This is also going to be outside too, so it's a beautiful day. We're going to make this quick because it is hot out here in this Texas heat. Okay, and if you think of any questions, you're more than welcome to ask them in case I forget something.
Okay.
Okay.
You ready?
Mm-hmm.
Okay, so today is
June 5th.
So it's a little less than a month.
Mm-hmm.
And we're going to just go over some things and to see how well you have done in this month's time. I think you've done remarkably well.
Me too.
So let's get to it. Okay, first question is, why did you decide to have a left hip anterior replacement?
So I decided to have a left hip replacement. First of all, I've had my right hip replaced. I had that done when I was 22 back in 2004. But I always knew that I would need a left hip replacement. I knew back then, but I prolonged it because the first experience just is a very long recovery. But I decided to go ahead and get it done because I was in so much pain. I did have hip injections, but after a while they just stopped working. So between me and my pain specialist doctor, we decided that it was best to just go ahead and get it done. So yeah, it was very painful, to say the least.
What are the things you had to take care of before having the surgery?
So I would suggest you guys speak with your employer to make sure that there won't be any type of, I don't know, let me scratch that. We'll rewind. Okay, so you basically want to go to your boss, your supervisor, let them know that you are going to be out due to having a hip replacement, just to make sure you have all your ducks in a row, that your job is protected, that you'll be getting paid. So you definitely want to make sure that you take care of all your paperwork when it comes to being off from work, because they can be a little slow when it comes to turning in paperwork. You just want to make sure you have all your ducks in a row to make the process run as smooth as possible. And then what else do we have to do? I had some appointments that I needed to take care of before my surgery. So I'm anemic, so I basically didn't have any iron, so I needed to get 2 iron injections before I had the surgery, just to make sure that that was covered, because I did not want to have a blood transfusion. And then, you know, you had to get labs done. And then you want to make sure that you know which labs and which urine specimen they're going to need, because they'll say one thing that you need to go and get urine done, and then you go to your next appointment and then you come to find out you need urine there. So you just want to make sure the whole urine specimen is clear, because if you get to your appointment and you've already, you know, peed before you got there, then you're going to be there for a long time, or you'll just have to reschedule. So it's just best to make sure which labs are going to be done when you go to your appointment. For your pre-op appointment.
What about your living arrangements for after surgery?
Yes, so me personally, I stay with my parents. It just made it much easier. They have a walk-in shower, so it was, you know, best to have that part of my recovery, because you're really unable to lift that leg up when you initially come home from surgery. So that was a big help. My mom helped me with my recovery. So it's best to have a good support system with you during this transition of getting better. So yeah.
How long was your surgery?
That's a good question because I was knocked out, but they told me prior to surgery that it was going to be an hour to 2 hours, and that's including post-op recovery. So how was it, 2 hours or less?
Well, the surgery itself was about, I think it was close to 2 hours. It seemed like it was close to 2 hours. I honestly, it wasn't over 2 hours. It might have been an hour and 30 minutes. But your post-op recovery was an hour.
Okay.
Yeah, you stayed back there an hour, so before going to your room.
Yeah.
So,
also, you want to make sure that all the financial responsibilities are made clear before you even get to the hospital to have your surgery, because I was told 2 different things. Luckily, I'm very blessed that everything worked out in regards to the financial part. So I was very thankful for that, because I was told one thing and when I got to the hospital I was told another, but it actually worked out. And then also make sure that you don't have to use the restroom again prior to surgery, because they're going to want a urine specimen that morning or that afternoon just to make sure that you're not pregnant. So in my case, I couldn't use the restroom because I had already done so prior to the appointment. So I just had to sign a waiver saying that I wasn't pregnant, but to each his own.
okay. How long was your hospital stay?
My hospital stay was very fast. I only stayed there for 1 night. They want you up and walking a few hours after you're done with surgery. So there's
Actually, you had to go to the bathroom when you got back to your room.
See?
And you had to get up and walk to the bathroom.
Yes. I did have to get up to go to the restroom because I didn't have a catheter. They didn't put a catheter in because I was only staying for 1 night. So, you just have to mentally prepare to get up and walk.
Yeah.
So, yeah, I didn't have a choice.
Girl of steel. Medication after surgery and advice for pain management while in the hospital.
Yes, so from my experience, I had a very hard experience when it came to the pain management after surgery, because my body is used to having pain medicine on the daily. So my body was not, what would you say? The medicine just didn't work. They gave me tramadol, which did nothing for me. Like, I was in a lot of pain and they just didn't understand. It took hours for them to even talk to the pain management specialist, because they really just didn't want to give you a lot of narcotics. But I told my surgeon afterwards, each patient is different, each pain tolerance is different. So in my case, I needed something stronger because tramadol just wasn't cutting it.
Well, that was because you was on something stronger prior to surgery for so
Yeah.
long to deal with the pain.
Tramadol was like taking candy. It did nothing for me.
And once they gave it to you, once they gave you a stronger medicine,
Yeah, it relieved the pain for a little bit, but
you had to get there first.
yeah.
Okay. When you came home, how was PT?
So physical therapy was good. I had a female therapist. We did exercises. We went over all my medications that I was taking. We went over, and this is for the first day. So the initial day, I signed paperwork. We went over all my medications, what to expect from physical therapy, how long I was doing physical therapy. So the first week, she came twice. The next 2 weeks after that, she came 3 times a week. If she couldn't make it, then somebody else showed up. And then the very last week, she came once, and that's for discharge. So it was less than a month that I had physical therapy. But I graduated from a walker to a cane to not using anything. So it just, each person's different. So yeah, my recovery, I did really well. I'm very proud of myself.
Yeah, and you should pat yourself on the back.
Yeah.
That is good. Okay, what to expect your first post-op surgery appointment? What did you expect?
So my first appointment, they took out my staples from my surgery site. They removed all the taping, the dressing, and then they just put some tape over it, and then that would stay on for like a week, and then I was able to remove that. And my surgery site is coming along. They said it was going to be shorter than my first one, but they look the same to me, just in a different area. The anterior location is in the front of your leg, so mine is like right here. So it's like from here to here. I don't know if you can really tell, but yeah. I think it'll do well once it, continues to heal.
Can you tell them the difference between your first hip surgery and your
Yes.
this one? The difference between where the first one was done and where the first one was done, location wise, and then your experience with the tube.
Yes. So my first surgery, my incision site was more towards like the back of my hip buttocks area, and then I had a drainage tube that was like this.
It seemed like that big.
It seemed this big, but it probably wasn't. But it was very thick. It was on the front of my leg, and it was very painful when they pulled it out before I got discharged from the hospital. Like, I cried like I never cried before. Like, it was so painful. Whereas this time around, it was the little
side by sides of a straw.
Yeah,
smaller.
Probably smaller than that. It was like really thin, and the area was still numb. So when she pulled it out, I didn't feel anything. So that was a big relief. I think that was the most worrisome that I had, was the drainage tube. I was so nervous about that. So yeah.
So definitely this surgery was better than the first surgery.
Absolutely.
And your PT, everything. If you compare your first surgery to this surgery, your whole recovery is totally different. So
yes.
If you can get the anterior surgery,
yes, then get that one.
Yeah.
The recovery time is way quicker. They told me about 4 to 6 weeks, depending on the individual. And then the first surgery, the total hip replacement, was 12 weeks recovery. So it's a big difference. I mean, like night and day. Yeah.
Notice, can you notice the difference with your hip pain? Can you tell the difference between your pain that you have, if you have any, in your hip versus before the hip surgery?
Yes. So my hip pain that I'm dealing with now is not even hip pain. I have no hip pain. Like, I feel nothing. The only thing that I feel is soreness from the incision site, which is totally different from what I was dealing with prior to surgery. Like, I have no hip pain whatsoever. The only discomfort I have still is from the incision site. And I'm able to sleep on my side that I actually had my surgery on, which is awesome. So, yeah.
So your pain is...
So it's not necessarily the hip pain.
Because that was bone on
that was
bone.
bone on bone, yeah.
Yeah, so it's a whole different kind of pain.
Right. Right.
How is your mental health?
Mental health, very good from the past surgery. I was very depressed with my first total hip replacement because I had just gotten married, and then 2 weeks later I'm having a major surgery, and the recovery, it was just a lot going on. Rather than this time, I was expecting the surgery, I wanted the surgery, you know, I knew exactly what I was having and what to expect. So my mental is very good. I'm not depressed. I'm really excited. Like, I had a goal, and my goal was to be healthy enough to go see Jurassic World on June 10th,
Is that a
Friday.
plug?
Check it out. Yes, that's a plug. But yeah, I have to remember that I just had surgery like less than a month ago.
Yes.
So I have to remind myself, and my mother has to remind me to slow down, that I'm still in recovery.
Because if you saw her,
Yeah, I was dancing and everything yesterday, so.
yeah, you know, not overly dancing,
No.
but she was moving, and
Yeah.
I'm like, okay, chick, the hip still move. Yeah.
We went walking
And she-
yesterday,
and
though.
she walks better than I do. So
I would
if you
hope
didn't
so.
know, if we didn't know that you had hip surgery, a month ago, I'm gonna say a month ago,
Yeah.
we just looking at you walk, no one would know that you actually had hip surgery, hip replacement, not hip surgery, but hip replacement a month ago.
Yep.
So shout out.
Yeah. My doctor was awesome.
Yes.
His name is Dr. Jason Lowry. He's at the Baylor Scott and White Orthopedic and Spine. So yeah, in Arlington. He has an office in Mansfield. So that's a plug too. So yeah,
Bedside manner is
he's an awesome doctor. Like, I have, again, the only complaint I had was pain management after surgery, which that's not necessarily his fault. I wish the pain management doctor that knew I was having surgery would have called and talked to me. That would be my only complaint.
yeah,
So yeah, communication.
communication on that part.
Yeah.
Okay. Well, for those that are anticipating having a hip replacement, would you recommend this surgery?
I would. I really would, because you're not in the hospital for very long. I'm not sure of, you know, your age or whatever, but if you're young, I'm 40. So, I mean, whatever it takes to feel better, because I would not put this pain on my worst enemy. Like, having bone on bone was very painful. So I would definitely recommend getting a hip replacement. I would recommend getting the anterior hip replacement. The recovery's fast. You'll feel so much better. Your outlook on life is more clear. You have so many things to look forward to. I know I do. Walking, you take walking for granted. So
Your bucket list got a little bit
yeah,
bigger,
for
huh?
sure. Yeah. I have a lot of plans in my head that I would like to do now that I am feeling better. So, yeah. Let me put this out there, though. I mean, I do still have a chronic arthritis, which is ankylosing spondylitis. So, naturally, I will still have pain, but it's a different type of pain. So, you have to do your own research on, that's another topic. But would I have a hip replacement? Absolutely. I say go for it as soon as possible.
So, with all of your chronic illnesses, because it's more than just one.
Yeah, I have Crohn's disease and ankylosing spondylitis.
So, with you still dealing with those two, but overall, your whole outlook is better because you're not in that
Type of pain.
that kind of
Yeah.
pain anymore.
That pain from your hip, it consumes your life. Like, you're unable to sleep very well at night. You can't really do the things that you want to do. Yeah.
movement, walking,
Movement, everything. It just plays a major part. So get it done. Yeah.
Okay. Well, with that said, can we see you walk?
Yes. You can see me walk.
See how she get up? She just get up. I don't know. Can they see you? Oh. You're too funny.
That's me walking.
And sitting.
And sitting.
Oh.
Yeah. But I'm glad I filmed this. I really wanted to get this video out because there is someone out there that is having doubts on having a hip replacement. Take it from me. Get it done. This video was very important for me. And if you have any questions, feel free to leave a comment below. And yeah, if you need Dr. Lowry's information, I can totally give that to you. Actually, I'll leave it in the description below. But yeah, sorry for the noise in the background, but we are outside in this Texas heat. And yeah. Do you have anything to say?
Just proud.
Being the caregiver, a great caregiver.
But I had a awesome patient that was, you know, she had her goals set. She met her goal, and I'm just so proud. We're just proud parents.
Thank you.
know, because I don't know whether I could have.
Yes, you could.
No.
Yeah, you could. I forgot to mention that you do have to use this soap up to 3 nights prior to you having surgery. So let's say you're having surgery on Monday, you'll need to do it Friday night, Saturday night, Sunday night, and then they want you to do it, take a shower prior to surgery with the soap. They'll provide you with the soap and the loofah, and then you have to change your sheets every night also. So I forgot to mention that. So if you have any pets that are very active, they'll tell you all this in the video, but you have to be very careful because you don't want to fall. That won't be good for you or anybody else. So yeah.
You also have to rearrange furniture and rugs and all of that too. But all of that's in the video.
Yeah.
Okay. I think that's a wrap.
That is a wrap, guys. Thank you so much for taking the time to watch my video. Please don't forget to rate, comment, and subscribe. And I will see you on my next video. Bye. Thanks, Mom.
You're welcome.
Mwah. I wanted to mention that my dad was a great support system as well, along with my mom. So both of my parents helped me out during this recovery period. My dad came with the laughs and kept me entertained like he always do. He's just so funny, him and his dad jokes. But yeah, so I thank both of my parents for going with this journey with me. So yeah.